Welcome students. This is Clinical Toxicology lecture number 2 for the 4th year Form Day students. We have already discussed about the general procedure and general management of toxicity. This is about antidotes and the topic is interesting and a small topic, and in this lecture I have discussed some of the questions which have been asked by KUHAS, Kerala University of Health Science, Thrissur. So I hope this will be more helpful for the students, what extent they may ask questions in this chapter. So past Kerala University of Health Science questions from antidotes and their clinical applications. A 10-mark question was asked in February 2015. Define the term antidote and list out the commonly used antidote. Mention their indications and its clinical significance. So they have asked the question in a wider so that the student have to list out with some examples, and 10 mark. And a 5-mark question in February 2016 discussed the role of antidotes in the management of acute poisoning. 5-mark question. And again in June 2016, 5-mark question they have asked, discuss role of antidotes in poison management with examples. 5-mark question. And they simply asked in December 2018 just antidotes 5-mark questions. So the student should know different antidotes, classifications and its actions and its adverse actions, because many very important side effect and adverse actions, because we are dealing with toxicology, clinical toxicology. It's needed for the students to write about the adverse actions also. Explain the role of antidotes and its clinical application. 5-mark question in January 2021. After the corona they have asked. And you see another 5-mark question again in November 2021, the same year. Write a note on antidotes with examples. 5-mark question. And in March 2022, 5-mark question. Discuss in brief the various antidotes with its clinical application. And again 5-mark question in March 2022, that is 22. It is not March, it is the next. I have written March. It is again about the December. Write down the clinical symptoms and antidotes of pyrethrons. Actually, antidotes for pyrethrons, there is no antidote till now, directly specific pyrethron antidote. But we have to write this clinical symptoms of pyrethroids. 5-mark question. Role of antidotes in management of poisoning. 5-mark question. They have asked in January 2023. So this is a small topic. We can expect a 5-mark question. Even why not, it is possible to ask even 10-mark question. So we have to prepare in such a way. The student have to have an idea about what is an antidote, what is its classification, some example and its adverse actions. So now, what is an antidote? Agents counteracting on neutralizing the action of poison. Poisons, when it is plus with antidote, destroy, poisoning effect. Easy, the student can understand. Antidotes are classified based on their mode of action into three categories. One, mechanical or physical antidotes. Number two, biological antidotes. And number three, chemical antidotes. So students should write in such a way what all the things which you are going to explain in the paper, so that the valuer will give the full mark. You see, in physical antidote or mechanical antidote, you have to explain about dilution. That means physically diluting the toxic substance, dilution. Decontamination is also physical activity. Active charcoal, usually it can be taken as a chemical, but it is an absorbent capacity, physical property. So, activated charcoal application and physical support. Many physical support you can give. Breathing support. Why not? Blood purification by hemodialysis is also physical support. Hemodialysis or hemoperfusions after giving support by breathing, this also comes to the physical antidotes. So you see, there are 5 categories we have to explain about physical antidotes. Antidotes, not only the substance given you should not make, the activity also, it neutralizes the action of the poison. So they are also taken as an antidote. Biological antidotes, we know that anti-venom, we know anti-toxins, TT, very long back it is available. Monoclonal antibodies, specific acting towards the venom, towards the antigens, monoclonal antibodies, recombinant enzymes. So, these are biological antidotes. When we come to chemical antidotes, neutralizing antidote by chemical action, binding antidotes, you know about binding, binders which bind the poison and excrete, binding antidotes, enzyme modifying antidotes, chelating agents, chelating agent antidotes, receptor antagonists, they are also comes under chemical antidotes. So these all the student have to remember in 3 categories. We are just giving some explanation. Very few you can explain even by your own, because in the heading itself you can understand. So first what we said, dilution in mechanical or physical antidotes. Physical antidotes act by interfering with the toxins' ability to be absorbed into the body rather than directly neutralizing it or reversing its effect. It just absorbs, it just interferes. How? First one is dilution. You can see the picture. When there is a concentrated liquid, concentrated acid or something which falls on the eye, better you have to water, you have to use for diluting. Any concentrated substance, any toxic substance or any antigens, any powder or any dirts have been irritating in this. Is a simple example. When a toxin toxic substance comes into contact with the skin or eye, immediately rinsing with copious amount of water can help to dilute and wash away the chemical, reducing its concentration and minimizing its effect. Number 2, in physical antidote procedures, decontamination. This involves removing or neutralizing the toxic substance from the body or the affected area. Methods can include thorough washing, removal of contaminated clothings, or use of absorbent materials to soak up the substance. And you can use activated charcoal, which is available in the form of granules, in the form of tablet form, which can be given into the GIT and control the absorption, reduce the absorption, eliminate the absorption. While typically classified as a chemical antidote, actually the activated charcoal can also be considered as a physical antidote. The mechanism of action involves the adsorption, surface phenomenon of poison inside the GI, gastrointestinal system, thereby inhibiting their adsorption into the circulation. Number 4, physical support. In some cases, physical support measures may be considered as part of the treatment for toxic exposure. You have to give respiratory support. This can include providing respiratory support as shown in the picture, maintaining proper body temperature, even or administering fluids by means of large volume fluids, maintaining the hydration. Number 5, hemodialysis or hemoperfusion. These are physical treatment used to remove toxins from the bloodstream in case of severe poisoning or overdosage. Hemoperfusion, it is an adsorptive therapy that uses activated carbon cartridges as shown in the picture or divinyl benzene resins, which can purify by its adsorptive capacity. Hemodialysis involves filtering the blood through the machine to remove toxins. As shown in the picture, dialysis can be done, while hemoperfusion uses an adsorbent material to selectively remove certain substances from the blood. Now we are coming to the biological antidotes, in which first we told antivenom. Antivenom is produced by extracting venom from poisonous animals such as snake, spider or scorpions. The venom is used to immunize animals, usually horses, or sheep which produce antibodies against the venom as shown in the picture. Traditional anti-venom procedure, the venom will be injected to the animal in a whole venom and then the blood is collected. Then the antibodies IgG purification is done and the purified anti-venom against the whole venom can be used after proper analysis and the quality control. These antibodies are collected, purified and used as anti-venom. Anti-venom and antitoxin in a crucial treatment for venomous poisonings, particularly snake bites, as it neutralizes the effect of corresponding venom when administered to humans who have been envenomed. Number 2, antitoxins, which we know about tetanus toxoid TT, which is present a decades, 2-3, long back. Antitoxins are biological substances containing specific antibodies that neutralizes the effect of the toxin produced by bacteria or other organisms. Antibiotics are used for the purpose of managing certain bacterial illnesses or migrating the effect of toxin-induced poisoning. We know that TT, tetanus toxoid, botulism antitoxin, diphtheria antitoxin BP. Examples include diphtheria antitoxin, botulism antitoxin and tetanus antitoxin. Number 3, in biological antidotes, monoclonal antibodies. Monoclonal antibodies are laboratory produced antibodies that are designed to bind to the specific targets or the substance in the body. They can be developed to act as antidotes for certain diseases or even toxins. For example, monoclonal antibodies have been developed as antidotes for specific type of venoms such as snake venoms. Monoclonal antibodies, MABs, the symbol shown in the bracket, you might have seen in many places when you are studying in human physiology and pharmacology, are being developed as potential treatments and diagnostics for venom envenomation, that is envenomation, with some studies showing promising result in neutralizing venom toxins and lethality in the animal models, paving the way for the future recombinant antivenoms. Number 4, recombinant enzymes in biological antidotes. In some cases, genetically engineered enzymes are used as biological antidotes. These enzymes can catalyze specific reactions that counteract the toxic effect of certain substances An example of recombinant peroxidase which can detoxify organophosphate pesticides by hydroxylizing them. Now we are coming to discuss about the chemical antidotes. Key aspects of chemical antidotes. Specificity. Chemical antidotes are often designed to target a particular toxic substance or class of toxin. Administration also differ. The administration of chemical antidotes might vary based on the antidote and the characteristic of the poison. Administered of a medicine may occur through several routes including oral, intravenous, intramuscular or other suitable methods. Timing is very important when you are applying these chemical antidotes. The promote delivery of the chemical antidotes is often a determining factor in their success. And also dose also. Antidotes, overdose or antidotes in wrong time, it may also causes many adverse actions. Chemical antidotes can be classified on basis of their modes of action or the specific toxin they counteract. First one is neutralizing antidotes. These antidotes work chemically by reacting with the toxic substance to neutralize its effect. They may involve acid-base reactions, redox reactions, and other chemical reaction to render the toxin less harmful or inert. Binding antidotes. These antidotes work by binding to the toxic substances, forming a complex that reduces its bioavailability or prevents it from interacting with its target receptors or enzymes. Binding antidotes can reduce the absorption, distribution, or the toxicity of the toxic substance can be controlled. The kinetics can be controlled. Enzyme modified antidotes. These antidotes act by modifying the activity of specific enzymes affected by the toxic substance. They can either activate inhibited enzymes or inhibit enzymes that are overactive due to the toxin's effect. On the whole, enzyme modified antidotes have to counteract the toxic effect. Chelating agents. Chelating agents refer to chemical substances that possess the ability to bind to heavy metals or certain minerals, hence forming complexes that exhibit stability and they suppress the toxicity. Fifth one, receptor antagonists. Receptor antagonists are chemical compounds that bind to specific receptors in the body, blocking the toxic substances, binding and reducing its effect. They can competitively inhibit the toxic substances interactions with its target receptors, preventing or reversing its toxic action. So some of the example of antidotes in clinical use, the questions they have asked, we have selected some 19 antidotes, easy to remember, not very tough one we have taken. One, naloxone, it is used for opioid poisoning. It's an antidote, chemical antidote. Two, clinical use, flumazenil is used for benzodiazepine poisoning. Atropine is used for organophosphate, nerve agents, nerve block agents, organophosphorus substances, most commonly used as in pesticides. Atropine is a choice for the antidote. Pyrrolidinoxim, 2-PAM, is used for organophosphate poisoning. In agriculture sector, you might have seen most of the people are getting poisoned. And when they come for the treatment, this is the antidote available choice. Physostigmine, you might have studied in pharmacology. It is used for anticholinergic drug poisoning. So one who is poisoned by atropine, you have to go for physostigmine treatment. Anticholinergic poisoning can be treated with physostigmine. Fomepizole, or in the trade name it is called antisol, which is used for ethylene glycol methanol poisoning. This usually happens by means of, in the local area, you might have seen about the local, there are many incidents happen recently. Methanol mixing in the local Araki, and people are poisoning, and many people died even recently. Not only here, in all over the world. In India it is more. Local Araki, they used to mix with the ethylene glycol and methanol. They are dangerous, they are poisonous. They cannot be detoxified by the liver. So this is the antidote available in the market. Fomepizole. Antisol is the... Ethanol can also be given as an antidote when there is poisoned by ethyl glycol or methanol. Ethanol is also one, it is an competitive antagonist to save the person. Number 8, acetylcysteine means immediately the student should remember about paracetamol. Acetylcysteine not for paracetamol, it is for beta blocker overdoses. Acetylcysteine is for beta blocker overdoses. Sorry for telling that. Acetylcysteine is for beta blocker overdoses. Glucagon is for there is a small mistake is there. I feel we have to correct it. Acetylcysteine is for, and this beta blocker overdoses is having a small mistake is there. Glucagon and acetylcysteine is having a small variation. We will correct it. I hope I have to correct that. 1 minute. Let me correct it. And so that it will be easy for the students not to be in a mistake manner. Yes, it is for paracetamol, and we have to make it in such a way. You should not make acetylcysteine. It should be for paracetamol. So this one I am just making it here. And this should be here. Understand? And also glucagon is for beta blocker poisoning. So that is what the small correction immediately when I was lecturing, when we found it is needed to be corrected. Otherwise, student will be in a wrong study, because you write these books, sometimes they are making mistakes, and so it is very, very important. The student now, acetylcysteine is for paracetamol, because when I studied, I remembered very clearly. So we are coming to the place where we stopped now. So see here, it is very, very important for the student should not change the antidote for any drug changing. Don't forget, for ethanol we have antisol, flumibazole, and ethanol can also be given as an antidote, and acetylcysteine is specifically for it is the last one, it is coming. Acetylcysteine is for acetaminophen, paracetamol. Glucagon is for beta blocker overdosage. Calcium gluconate is for calcium channel blocker overdose. And deferoxamine, it is for iron poisoning. Dimercaprol, ball it is called, British anti-Louisette. Ball, it is on heavy metals, lead, mercury. Ball can be used as an antidote for many purposes. Calcium disodium versinate, lead poisoning. For cyanide, hydroxycobalamin and sodium thiosulfate can be used as an antidote. Protamine can be used for heparin poisoning. Vitamin K is used for as an anticoagulant poisoning, warfarin poisoning. Methylene blue is used for meth hemoglobinemia, and digifag is used for digitalis digoxin poisoning. So these all are some of the examples which we have taken. Individually, some explanation with its adverse actions I have explained. Naloxone is for opioid poisoning. Opioid receptor antagonist displaces opioid from the receptors prescription medications may be taken overdose, such as oxycodone, oxycontin, hydrocodone, Vicodin, morphine, codeine, fentanyl, and other are many uses for the treatment of pain. As shown in the picture, you can see the displacement of the opioid receptor can be displaced by naloxone. Side effect, we can see agitation, body aches, chest pain, coughing that sometimes produces a pink frothy sputum as shown in the picture. Crying more than usual in babies can be seen. Difficult or trouble breathing. Excessive crying can be seen. Fast pounding, beat will be very fast. Irregular heartbeat or pulse can be seen. Flumazenil, we know that benzodiazepines, diazepam, nitrazepam, overdoses, poisoning, benzodiazepine receptor antagonist. This flumazenil is also have a similar structure of benzodiazepine. Side effects, when you see confusion, dizziness, headache, impaired cognition, abstotonus. What do you mean by abstotonus may happen? That means, see, the person has been completely his bone tetanus means it will become like stiffness from starting from the neck. A dramatic abnormal posture, you can see that due to the spastic contraction of the extensive muscle of the neck, trunk and the lower extremities, that is legs, that produces severe back arcing from the neck to heel as shown in the picture. Shivering may occur. Somnolence, sleep, dream sleep can be also obtained. Atropine, it is used for poisoning which happens due to organophosphates, nerve agents, that means nerve block agents. When you give atropine, how it acts? It blocks the excess acetylcholine at muscarinic receptor. It is an anticholinergic drug, so it blocks the excess acetylcholine at muscarinic receptor. Side effect, bigger and dilated or enlarged pupils can be seen, blindness can be seen, chest pain, discomfort or tightness, decreased vision and decrease in urine volume, decrease in frequency of urination, difficulty in passing urine. So eye and urination, we are more difficulty can be seen. Difficulty in swallowing also can be seen. Very simple to write the side effects which may be caused by the atropine when you are using as an antidote in organophosphates or nerve agents, nerve block agents. And pyridoxine 2-PAM, it's seen. It is an antidote for organophosphates. Reactivates inhibited cholinesterase enzymes. Ampules are available. Side effects you can see: blurred and double vision, change in near or distant vision, difficulty or rapid breathing, difficulty in focusing the eyes, difficulty with speaking, and fast and pounding or irregular heartbeat or pulse can be seen. Muscle stiffness or weakness can also be seen. Pain at the injection area after injection is into the muscle. Physostigmine, which is used for anticholinergic poisoning, reversibly inhibited cholinesterase increases acetylcholine levels. Serious side effect of physostigmine includes increased urination or bowel movements, severe or worsening nausea or vomiting, increased sweating as shown in the picture. In the forehead and all you can see the sweating hand, palm, blurred vision, bradycardia, less heartbeat, and you can see excessive salivation and the signs of the allergic reaction. Hives, difficulty in breathing. You can see the hives, redness of the skin, swelling in the face, lips, tongues and throat can be seen. Fomepizole, antisole. Fomepizole, antisole can be used for ethylene glycol, methanol poisoning. Inhibit alcohol dehydrogenase, prevents toxic metabolite formation. Common side effect of antisole include mild skin rashes, heartburn, nausea, vomiting, diarrhea, loss of appetite, dizziness, drowsiness, anxiety. Ethanol can also be given, but when it is given in intravenous, it is having lots of issues that we will see what is the side effect. Ethyl, ethylene glycol or methanol, when it is mixed in a local araki, then the people will be in a problem. Competitive inhibitor for alcohol dehydrogenase prevents the conversion of toxic substances. Side effect, when used to give as an antidote for methanol or ethylene glycol poisoning, ethanol can cause side effect like central nervous system depression, hypoglycemia, nausea, vomiting, and in some cases phlebitis. What is phlebitis? Inflammation of a vein. You can see the picture in the thigh area down, inflammation of the vein. You can see the redness. This can happen if you are giving usually ethanol as an antidote when they are poisoned with methanol. Or hypertoxicity and hyponatremia, especially with intravenous administration of the antidote, it causes. The hypernatremia is associated with the increased serum osmolality, more than 95 osmol per liter, MOSM. 8. The acetylcysteine, as I told, it is for paracetamol, acetaminophen. As we have edited, you can see there is paracetamol, acetaminophen. Restores the glutathione level, detoxifies the reactive metabolites. And the side effects when you are using more acetylcysteine for paracetamol poisoning: blurred vision, confusion, difficulty with breathing or swallowing, dizziness, faintness, or even light headache when getting suddenly from a lying and sitting position, feeling warmth, hive and itching, rashes without a fever, redness in the skin, especially around the ears, can also be seen. Glucagon is for beta blocker overdoses, increase the cycloadenomonophosphate levels, counteracting the effects of beta blockers. The cycloadenomonophosphate effect, the side effect: rashes, itching, troubled breathing, troubled swallowing, any swelling of your hands, faces or mouth, or light headness, dizziness or fainting. Calcium gluconate, calcium channel blocker like nifedipine, suppose if they are overdoses, antagonize effect of calcium channel blockers. Side effect, allergic reaction, sun, that is skin rashes, itching, hives, swelling of the face, lips, tongue, or the throat like as shown can cause fast or irregular heartbeat, and high calcium level increase thirst or amount of urine, nausea, vomiting, confusion, unusual weakness, fatigue, bone pain, low blood pressure, dizziness, feeling faint or lightheaded, and blurry vision. Deferoxamine is an interesting ion. Binding to iron facilitates its exertion. Side effect, bluish fingernails, lips or skin, blurred vision or other problems with vision. You can see the blue in the lips surrounded that lady, how he has shown in the fingers are bluish in nature. Convulsions, seizures can also occur. Difficulty with breathing and fast breathing, hearing problems, redness or flushing of skin. Dimercaprol is the first antidotes, British anti-illicit, heavy metals, example lead, mercury, all these things can be, dimercaprol can be used as an antidote for heavy metals. Form stable complex with the heavy metals. Side effect, nausea, vomiting, abnormal pain, tachycardia, hypertension, headache, burning sensation in the eye, nose and mouth. Diaphoresis, lacrimation, that means eyes, you can see the secretions, the tears, lacrimation, and also blepharospasm. What is blepharospasm? Drooping of the eyelids, difficult to open. Rhinorrhea by lots of running nose and anxiety. What do you mean by blepharospasm? Twitching of eyelids, often leading to forceful and frequent closure, and in severe cases functional blindness, as shown in the picture. You can see the dot is shown. Calcium disodium versinate, lead poisoning, chelate lead enhance its excretion. Common side effect of calcium disodium divalent versinate include fever, chills, tired feeling, muscle or joint pains, numbness, tickling feeling, that is tremors, running and stiff nose, etc. And you can see number 14 and 15, hydroxycobalamin, that is cobalamin, and sodium thiosulfate. These both are used for cyanide poisoning. You know about cyanide? It's dangerous. Binding to cyanide forms a non-toxic cyanocobalamin. Cyanocobalamin structure, you know that vitamin B12, it has CN. So cyanocobalamin converts into cyanocobalamin as a non-toxic substance, converts cyanide to even thiocyanate, less toxic form. Both of them, they have that action. Side effect of sodium thiosulfate, you can see black, tarry stool, bone pain, cough and hoarseness, decreased urine, high blood pressure, increased thirst, irritability, lower back or side pain, and side effects of hydroxy or hydroxocobalamine. The brand name is Cobalin H, neocytamin. Pain, swelling or itching skin wherever you had the injection. These symptoms are usually mild and should only last a few hours. Feeling or being sick, nausea or vomiting, diarrhea and headaches, feeling dizziness, hot flashiness. Protamine is used for heparin poisoning. Binds to heparin, neutralizes its anticoagulant effect. Side effect, the most common adverse effect associated with protamine administration includes an anaphylactic response, allergic, very anaphylactic shock-like, consisting of systemic hypotension, pulmonary vasoconstriction, allergic reaction, pulmonary hypertension, bronchoconstriction and bradycardia. Vitamin K is used for anticoagulant poisoning like warfarin when it is more, if it is having poisoning, promotes clotting factor, it is having another action, promotes the clotting factor synthesis, counteracts the anticoagulant effect. So side effect, pain, swelling or soreness at the injection site may occur. Temporarily flushing, taste changes can be seen, dizziness, rapid heartbeat and sweating, shortness of breathing and bluish lips, as just now we shown, nails, fingers are becoming bluish, may also rarely occurs. 18. Methylene blue is used for hemoglobinemia. Converts the meth hemoglobin back to hemoglobin. Side effect, agitation, bluish, colored lips and fingernails and palms as we have seen in 3 places, chest tightness, confusion, dark urine, difficulty breathing, difficulty in swallowing, dizziness or light headness. The last one which we have taken as an example is Digifag. Digital is digoxin toxin. Somebody is taking digital digoxin tablets or even poisoning by the herb digitalis, bind to the and neutralize the digoxin, reduces its toxic effect. And is available Digifam, specific antibody fragment, which is prepared as an injection, which can neutralize, reduces toxic effect. Side effect, a light headed feeling like you might pass out, heart problems, swelling, rapid weight gain, feeling short of breath. A question which I was telling that, which I have not explained in this lecture, I have added, write down the clinical symptoms of antidotes for pyrethroids, 5-mark question in March 22, they have asked, 2022. Pyrethroid poisoning symptoms can range from mild to severe, including skin irritations, nausea, vomiting. We can treat skin irritations, nausea, vomiting, tremors, and severe cases, seizures and coma may occur. But there is no antidotes as per the question which is asked. No treatment focuses on the, there is no antidote direct treatment, but treatment focuses on the supportive care and managing the symptoms which I have shown. So we can do decontamination, remove any remaining pyrethroids from the skin by cleaning, washing and on the eyes and wash with soap and water. Supportive care, focus on managing the symptoms and maintain vital functions, very important. No specific antidotes, we know that. There is no specific antidote for pyrethrin poisoning. So treatment is sympathetic, adrenaline, sympathetic and supportive matter you can perform. Seizure control. Benzodiazepine may be used for controlling the seizures if there is any type of convulsions is there. Monitoring. Closely you have to monitor vital signs including respiratory and cardiac function, and kidney functions should be given priority for the patient. So this is just a question which they have asked. I have given some idea. So I hope this will be helpful for the 4th Form D students. Just a small lecture. Next class we will see in other toxicology according to the questions and the syllabus. One classes will be supportive for the students. Thank you. Thank you for being